You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. We're talking about the term is called full mouth reconstruction. According to my first guest, your teeth are never too far gone to have the smile that you've always wanted. With us, we have an expert on the topic, Dr. Jay Gohel. Dr. Gohel, welcome to the program.
Thank you, Randy. Thank you for having me.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll get to as many of those as possible, but give us a working definition. Like, what is full mouth reconstruction mean? I guess this is dental talk.
Yes. Full mouth reconstruction is a varied topic, Randy. I mean, I don't know where to start.
Okay.
It can start anywhere from a single crown or a bridge to a complete smile makeover for somebody that just changes their lives completely. You know, it gives them a whole new lease on life, and tears well up, and they're just so happy to see. It can include simple, single implants or a full mouth of implants if need be.
Okay.
So
now your practice, and I know it's not a recognized specialty, but I think some of the terms that they use, like super specialists, I mean, you do a lot of things.
yes.
So tell us the different things you do in your practice.
Oh, we do everything. We from A to Z. We cover simple implants, crowns, root canals, orthodontia, braces, Invisalign clear aligners, to periodontal gum therapy, including lasers, Botox. People, that's the latest and greatest. Periodontal surgery, gum lift, the pinhole. That's becoming very, very popular these days. Called the lunchtime gum
For
lift.
gum recession.
For receding gums. Yes, absolutely.
So you have this new concept that's going on in certain practices where everything's done in one place.
Absolutely.
Or
yes.
normally you might go to a specialist for this or a specialist for that. You do it all right there.
We do it all under one roof, everything under one roof. And the reason for that was because, a lot of my patients would complain, they would go from one office to the other. They're just shipping, it's like farming it out, they get tired. These are working people, right?
Because nobody likes going to the dentist anyway.
Nobody likes going to the dentist, and they're taking off of work and they're going to one office, then they're going to another office. It's like, where does this end? When do I actually live my life? And they get tired of that. And, I wanted to help my patients, and I said, you got to give them a one-stop shop solution to get the work that they need done in a timely manner so they can live their lives. Teeth are one aspect of their life, so we want to help them live the life of their dreams.
Now, you're a dentist, so it does not surprise me to hear that you think that the teeth are the most important thing. How important is a smile, in your opinion?
Yes, I guess you would say that as a dentist, but if for a dentist, yes, a smile is important. But for a normal person, for average Joe, average Jane, it's so important to be able to live the life the way you want to be able to date the person that you like, to be able to go on a date with them to a restaurant, to be able to eat anything you want from the menu and not be held behind. You're at a party, you're hiding behind your smile because you're afraid to kind of put your best foot forward.
Are there a lot of people ashamed of their smile? I mean, you hear these stories, obviously.
I hear these. Oh my God. I mean, they probably won't tell you, but when they come in, they're like, Doc, when you go to a party, you see the guy or the girl across the room, and they're smiling and they're happy, and they're
the charisma.
The charisma is it's amazing. It's like it's magnetic.
Yeah.
And then you see this one person at the corner of the room, they're afraid to talk to someone. You feel like they're having a bad day, or they're mad, they're upset, they're angry. But it's just because they're afraid to smile, and it kind of just covers everything else about their persona.
Can you spot it as a dentist? Like, you could tell who's hiding their smile?
Now I can.
Okay.
Yes, it's fairly easy now because that's holding them back. It's just one small thing, but it makes such a big difference in their whole career, in their whole personal and professional lives. So you asked me how important the smile is. In just about every survey that's done, look at Gallup, look at Elle magazine, look at Cosmopolitan. The smile is the first thing people notice, in their potential mate, and or it's in the top 3. So
yeah, when surveyed, that's right.
Yeah, absolutely. So it's important. Take Hollywood, for example. If you want to make somebody look poor, what do? You take away a couple of their teeth.
That's a good point. Like in a movie, you want to make somebody look like a street person and mess up their teeth.
You darken up their teeth. You make them you give them buck teeth. And all of a sudden people start judging that person. They think they're from a poor background, or they're not as educated. So it kind of sets. People start judging you just based on your smile. If you had a job interview, if you have 2 sisters coming in, right, and one is smiling and chatty, and she seems well adjusted, she's happy, she's outgoing, she's interacting with you, and the other sister is kind of bashful, she's very stoic, she's not smiling, who do you hire? You know, it's a very,
Well,
very
the one
easy.
that looks confident,
exactly.
right?
The one who's well adjusted, the one who's social. You know, we call it the social six. You know, you got
The social six.
Social six.
Because you're showing like 6
Because you're
teeth or
showing
more.
6 teeth. You know, it's like you want to put your best foot forward. So it's extremely important, not because I'm a dentist, but I think it's important because people want to be themselves. People want to show who they really are and not hide behind a facade because they're being held behind. You know, there's a good quote I recently heard. It says, "Everything that you ever want is on the other side of fear." You know, people are afraid to go to the dentist. You know, but if you just come in for regular dentistry and kind of get on the right path, you know, it just changes your life. Simple things. Let me tell you what I've witnessed in my own practice when we've changed somebody's smile. These people have just avoided going to the dentist for many years. You know, they're kind of out of the cycle. They're out of the network, I guess, and they're just not coming in for their regular checkups and cleanings. And then they start to avoid. They kind of neglect comes in, you know, and when they come in and they get their workup done. And at the end, when you finally see the transformation, it's so liberating for them. I mean, I saw this one gentleman. He came in and he had no back teeth. You know, he wouldn't go out to dinner with his wife. You know, his grandkids. He would just avoid meeting people. You know, because people would, you know, as you get older, people want to go to dinner. They meet their grandkids, and people bring them food.
Okay.
You know? And they start hesitating because they're afraid. What are they going to eat? Let me tell you about this guy. You know, he's a big guy. You know, he looked like a Navy SEAL, literally. Okay. Couple teeth are gone. Some veneers are gone. So he busted a tooth because he likes to fight people, and they do it for fun. You know, he's like one of those MMA artists. You know?
Okay.
I gave him. I think I replaced one tooth, one implant, and I replaced one veneer. I mean, this guy just transformed. Okay, he's happy as can be. You know, he's like a teddy bear. You know, he's flirting with my assistants. He's flirting with the front desk. He's showing me all his photos of his MMA fights now. You know, it's unbelievable.
Just because of his teeth.
Just because of his teeth. Just because of his teeth. Can you believe that? I had this one lady who came in and she was really nice person. Really nice person. Single mom. Okay, working multiple jobs, really held back because of her smile. No back teeth, can't chew, doesn't like to go out with her girlfriends anymore, and just does not living their life. You know, she went to multiple dentists, and you know what they tell her? They tell her she doesn't have enough bone to get implants. I mean, that's their experience. According to their expertise, that's their limitation. She found us out. We with newer guided surgery, with newer cone beam scans, we gave her the smile that she wanted. And now look at her. It's a completely different story. She carries herself differently. Her hair is done. She's always happy when she comes in. She brings us food all the time now. You know, she's so happy because she can eat the food. She can enjoy the meals at the restaurants with her friends, and she's just living the life that she wanted to live, and not having to avoid going out with her friends, not having to avoid going out with her children and her grandkids, and being held back because she couldn't chew. You know, it's unbelievable. It's so liberating to see that.
So with your patients, because you do porcelain veneers, you have a machine, I guess, that makes crowns while they wait, right there.
Absolutely,
so
right there.
So you're able to do like a veneer, maybe if they're missing one tooth, you can give them a dental implant. So it's all right there.
It's all right there. It's all right there. Do not have to go anywhere else.
And you're big on sedation.
Yes, we are.
Who gets sedation?
Anybody who wants it. I had this one patient. Let me tell you about this story. In fact, I have photographs as well I'd like to share with you.
Okay.
Very scared.
Let's take a look at the photo.
Very scared.
Oh my goodness.
Does not want to get anything done. And obviously you see that because of the fear, you know, they do not want to come in, and then it just builds up and years of dentistry that has been postponed. Okay, and then they search us out, and they're like, okay, you know, they know that I need this because this is affecting my general health.
So to you, is this like a full mouth reconstruction? You got to kind of rebuild the whole mouth?
You got to rebuild. It's like a whole bevy of procedures that we're going to be doing. You know, it's like, God, where do I start here? It's so much work that needs to be done, so much work that needs to be cleaned up. But once it's done, it's a completely different person. Take a look at this.
Nice. Wow.
Completely different person. Completely different person. It's amazing. It's amazing how happy she is. You know, she's happy to go out with her family now. She's going to restaurants. She's meeting her girlfriends. She got sedated. We have an anesthesiologist right in the office. Don't need to go anywhere else. They come in, they put you to sleep. You wake up and you have a beautiful new smile. No downtime. It's unbelievable. Take a look at this patient, Randy. I mean, very apprehensive, very scared of the dentist. Okay, did not go for years and years, and then she comes in, okay, and we sedate her.
And this is one day? I mean,
This
are
is
you
one
able to
day.
do
This
this
is
in one
all
day?
done in one day, in a few hours.
Okay.
You know, we sedate her. She wakes up and she has a smile back. And look at that smile, Randy. Look at that eyes. You know,
looks happy.
those eyes tell you that she's happy. You know, she can smile when she wants to. She looks youthful. You know, she's carrying herself so confidently. She can go out and meet the people and greet the people and go to dinner and just live her life. You know, it's unbelievable how liberating that is for her. Okay, and we can all get this done in one day in the office. And let me tell you what would have happened normally in dentistry, Randy. She would have had to go to a different office to get her teeth out.
Like an oral surgeon?
Like an oral surgeon.
Okay.
Then she would have had to go to a periodontist. Then she would have had to go to a prosthodontist. You know, somebody's doing the implants, somebody's doing her crowns and bridges, and then she's coming back and seeing me. I mean, it's just the rigmarole, just the runaround. But now, with our office, it gets done in one visit. And not only that, somebody else would have probably just put her in dentures. I can't believe how sad that would have been. You know, now she's not in dentures. She's got a smile that's hers. It's fixed, doesn't need to come out. And it was all done in one day.
So this is this full mouth reconstruction. Can you ever be too far gone? Like, have you ever met somebody that says, there's nothing we can do?
Very rarely, Randy. That normally doesn't happen. With newer technology, with the newer cone beam scanning, with the newer guided surgery, I'm telling you, if the person can walk, okay, if they can hobble into our office, even if they come in a wheelchair. We just took care of an 89-year-old lady. 89-year-old, beautiful lady. She was so happy. She's such a kind lady. And she came in and she wanted to have a smile back. A lot of the offices that she's going to, you know, they're dismissing her. They're not listening to her.
Because she's 89.
Because she's 89. Because of her age, they're discounting her. They're like, okay, you're fine. Just get a denture. When I saw her, I knew I could help her. Okay. We took the scans, we did the workup, and now she has a fake smile. Okay. And for her 89th birthday, she got her smile back. You know, she came in all dressed up. She looks gorgeous. I mean, it's so
they
beautiful.
change. I mean, you do like a smile makeover,
We
like
do
a
a smile
cosmetic
makeover,
dentistry
like a
on these
cosmetic
people,
smile.
and everything just changes.
Everything just changes. I mean, they're just amazed. They all tell me, you know, Randy, they all tell me, I wish I'd done this 20 years ago. Why did I wait?
But that's the challenge. We all put things off, right?
We all put things
We
off.
wait
Life
and wait.
happens, you know, life happens. Life happens and we get distracted. We're looking after our kids, we're looking after our families and our parents, and we forget to take care of ourselves, you know. And when they come to me, you know, it's my job to take care of them and give them the smile that they've, you know, wanted, but just were not able to focus on.
Now this, okay, so when you're creating a beautiful smile, what percentage would you say it's 50% art, 50% science? Is it more art than science?
It's a balancing
think?
act. I mean, I think it's a combination of both. Dentistry is an art and a science. It's a perfect amalgamation of both, I would say, because there's so much technology that goes in, which is science. But then to create the smile, we can literally, with our newer technology, we can actually sit and design your smile the way you want it. If you want
Like
your
how?
teeth.
What do you mean?
You can actually take it is so amazing to see this thing come to life, because you take we actually use a technology that they use in Disney. You know, they're using the same computers to design the smile if you want your teeth longer, smaller, wider, narrower.
So you just show them on a computer what they're going to look like?
What they're going to look like even before we start. It's amazing. Whether you want veneers, you know, whether you've been hiding behind a dark, you know, a lot of people, you know, earlier, I would say maybe 20 years ago, tetracycline was big. You know, a lot of people would get sick and the doctors would give you tetracycline. So you'd see these people, you know, they always look upset. They're not upset. Their teeth are very gray. They
just can't smile.
They just can't smile. They're afraid to smile because they're just shy of smiling. And then you tell them, hey, listen, one visit, veneers, and you're done. You got the smile that liberates you, that sets you free, so you can get on with your life and go on those dating sites and go to those restaurants and go on those job interviews and just feel good about yourself, you know. And with the newer technology, you can get the veneer if you feel like your teeth are broad, they're narrower, you know, they're taller, they're not as white. We can give you a custom-made smile in 2 visits.
Interesting. Now you mentioned earlier about teeth in the back. Like if you're just missing 2 teeth in the back, you give them dental implants. But why, if you're only missing a couple of teeth and they're in the back, why fill them in with implants? Help me understand that.
That's a great question, Randy. Thank you for bringing that up. It's so important because our teeth are like, it's like a chain reaction that starts. You lose 1 tooth, right? Nobody's worried about that. It's in the back, it's not visible, I'm okay. That's what most people think. And that's what I hear all the time. It's like, oh, it's fine. It's one tooth, I don't need to worry about it. But then the other teeth start to shift. Our teeth are always shifting. And patients know that. A lot of patients, oh yeah, my teeth shifted.
So as you lose a tooth, what? You're not holding them in place as well?
You're not holding them in place as well. So one tooth shifts, then the top tooth starts to move down. Then you start getting food getting caught everywhere. You go out to dinner, you got spinach caught here, you got a carrot caught here. I mean, it's like you're creating a larder in your mouth to save food for later. No, that's not. That's not right. Yeah. You know. So, and then before long, you lose another tooth because you're kind of favoring one side because you can't eat on this side because you lost a tooth on this side. Now all of a sudden you've lost another tooth on this side because you're putting too much pressure here, and then it starts to snowball.
So ideally is what?
You just want to replace that tooth right away.
Okay.
You just want to replace that tooth right away. It's kind of like a car. I give some of my patients like an analogy for a car. If you have 4 tires and you lose one tire, you're not gonna be like, hey, listen, I got 3 tires. I'm okay.
Okay.
That car's gonna crash very soon. You know, God gave us 32 teeth.
It'll still drive, but not very well.
It'll still drive, but not very well. You know, essentially, yes. So you want to try and replace that tooth right away. Now you could replace it in multiple different ways. You could get a partial denture. You could get a bridge. You could get an implant. And with our office, the beauty of it is we all do it under one roof. You know, we have the technology. Believe it or not, we have the technology to get it done in one day. You come in, and if you're missing a tooth, we can replace that tooth same day.
So there is a movement going on across the country, you know, and we've had the show for 20 years, and I interview a lot of medical doctors and dentists, but where there's a group of people that you can't save their teeth. Full mouth of extractions, and then you put implants. But like you say, losing teeth can be expensive. That oftentimes you could save teeth and do a combination of procedures. Elaborate on that.
We actually pride ourselves on that. A lot of these patients, there's a big movement coming around that everybody's just pulling everybody's teeth and just giving them full sets. Okay, we feel like it's expensive to lose all your teeth right away. Okay, there's a sense of loss that goes with it. Can you imagine losing? Right? Can you imagine losing all your teeth? You know, all your teeth. That's a little scary to me. So I feel like I can help these patients. And my goal in our practice is if these patients come in and their teeth are salvageable, we will move heaven and earth to make sure that we can save those teeth. It's important. They're your own teeth. Okay, they're worth keeping. So we try to do whatever we can in our part to try and help the patients affordably keep their own teeth.
Now, what if they have really bad gums?
It's treatable.
Can they still do things like veneers and implants? And
my father, he's a dentist, and he once told me, you know, every case is manageable. You got to find out what needs to be done. If the gums are bad, we treat the gums first because they're the foundation of the. Think of a house with stilts. You got to build the foundation right. If the foundation's strong, then the teeth are going to be strong. So the gums and bone are the foundation. We make sure that the gums are healthy and clean, and then we will focus on the teeth. Can they get veneers? In many cases, you'd be surprised, Randy. We've had some beautiful results.
So you can go from really horrible, they say, I have bad gums, I got this, to brand new teeth.
Brand new teeth.
With veneers, maybe single tooth implant here and there.
Here and there, yeah, whatever's needed. We kind of plan the case out. Maybe they can't keep some of their teeth. They don't need to lose all of them.
Okay.
So if we can save majority of their teeth and give them the smile that they want, it's still a win-win. You know, they still keep their own teeth. They have the smile with the veneers or the crowns or the implants, whatever is necessary. And we can still work at getting them the fixed teeth that they're looking for. You know?
Okay.
So whatever the solution, every patient, it's like a custom solution made for all patients that are coming in. You know, and we are experts at designing it. We've got years of experience behind us, and we can get it all done in our office without a lot of downtime.
Okay, good. You have more photos.
I do.
What else
I do.
we looking at?
We have a ton of photographs here. So let's take a look at Erica here. Take a look at her. She's works in the legal profession.
Oh boy.
Very, very nice young lady. Very outgoing. Amazing personality, but held back by her smile. This young lady here is a very, very attractive person. I mean, that picture does not do justice.
Okay, yeah, I don't think so. Right, it's not so good.
Take a look at this one.
Oh wow.
I mean, she's Julia Roberts.
Yeah.
You know, you know, and I mean the result that we've gotten, she is so confident. You know, she's involved in meetings all day long. You know, she's at a very high position in her company. She's meeting with the hoity-toity of society. You know, she's out networking with people all the time, and I can't tell you what a difference that has made in her career.
So how do people even find out about you? currently?
We try to connect with our patient in a variety of ways. We send them a flyer every month to kind of tell them about our office, the services we provide.
Okay.
We're on Facebook, we're on Instagram. We have a dedicated team that's kind of giving the patients information inside our offices about the services we provide. We have the most reviews of anyone in our area. We are the most high-rated office on Google.
How many?
650, I think.
Is that right?
That is correct.
So people like you guys.
People like us.
So no matter how bad your smile is,
No matter how bad your
you
smile
can take care of it.
We can take
and
care
you call
of
it full mouth reconstruction, or at least
mouth
that's what
re-
we're talking about today.
Full mouth reconstruction.
So what else do you have? What other photos?
Take a look. This is an amazing story. I'm going to tell you a story about two lovebirds, high school sweethearts.
Okay, this is good already.
Joanne came to us.
Okay, let's take a look.
Take a look at her. She's got a wonderful lady. Again, same thing. You can take a look at her smile. She's got a lot of wear on her teeth. Okay, she's got some gaps there. Okay, that may or may not have bothered her, but now she's missing a lot of her back teeth, and she's just not able to eat what she wants. She loves carrots and celery and cucumbers, by the way. Okay, and she was just not able to function. No back teeth. Okay, and then look at her smile afterwards.
Nice.
She can't stop smiling anymore. I mean, she's just bubbly and chirpy, and she can't thank us enough after this. She was so happy with the service that we gave her, and she was so impressed that she referred her husband, her high school sweetheart, to us.
Okay, she drug him in.
She drug him in. She did.
Is that common? A lot of wives have to, because men put everything off. I mean, did they have to bring their husbands in?
Husbands are tough, They're tough guys. I mean, if you look at John is a man's man. He's strong. He's tough.
This is his new teeth right here.
This is his new teeth right there. He would not want to come in unless there was a problem, and he was missing his back teeth as well. But he wasn't concerned about it. He's a guy. He's not, doesn't hurt. Don't fix it.
So when you give them those back teeth back, let's say with implants, do they notice the chewing is like?
Oh my
is that
God.
what they notice the most?
New lease on life. You can eat steak. You can eat carrots. You can eat
Okay.
salads, nuts. People. I love nuts. I'm nuts
Okay.
about nuts. I mean, you gotta be able to enjoy the diet that you want. I mean, if they have grandkids, if the kids are coming in and they're like, "Grandpa, I got an apple for you here. Let's have it together." And now he's not afraid to bite into that apple without worrying about his teeth falling out. Isn't that liberating? Now there are lovebirds. Instead of
Call
worrying
them lovebirds. Okay.
Yes, they are lovebirds, and instead of worrying about their teeth and what they're gonna, how they're gonna eat and where they're gonna eat and what they're gonna eat, they're planning their next vacation, where they're gonna go, how they're gonna get there. Life has moved beyond worrying about their teeth now, because their teeth are in great shape, so they can live their lives like normal people. Let me show you. Can I show you a couple more photographs?
We got time for a couple
these
more.
These are our. I like to call them my models, because take a look at this photograph.
All
here.
right.
Amy's very, very high up in the retail industry, and again, same thing. She's been wanting to show off her smile. She never smiled. If you look at all her photos,
Is that what she told you?
Exactly. We have pictures after pictures of her, and she would never show her teeth. This is her after I finished her veneers.
Nice.
She can't stop smiling now. She can't stop smiling. Every picture we take of her now, she's showing off her teeth. She can't stop showing off her teeth.
Now they're probably doing selfies on Facebook,
Absolutely. Instagram, they're all over the place.
irritating their friends with all their
Irritating
selfies.
their friends and family with all their selfies. Absolutely. This is another one.
Okay.
Another one. Sarah, if you take a look at her, she was concerned. She had a lot of. This is an interesting case. A lot of enamel wear. What I've found is a lot of people are into the soda beverages. Like the Monster drinks and some of our carbonated beverages like Perrier and all of that stuff.
Yeah.
It's unbelievable that you would think that even though they're not as sugar heavy as we would think, but they still do a lot of
acidic.
erosion. Yes,
Okay.
acidic to our enamel. But
So when we look close at this before,
yes.
so those can't treat with whitening.
This can be treated with whitening. In fact, they get very sensitive, so we treat them with veneers. And the way we do veneers is really good, because we're not grinding your teeth down. We just do a little bit of small adjusting your tooth here and there wherever it's necessary. This gentle buffing, and then you put the veneers on in one day and take a look at the result.
Take a look. Very nice.
Take a look at the result.
That's nice.
Isn't that a beautiful smile? I mean, look at the eyes, look at the smile, look at the lip line, look at the youthfulness of the smile. It is just unbelievable how great she looks. And that's given her, she knows that she looks good, and she just steps out like a model. I mean, it's wonderful. It's wonderful to see them so confident. I got one more, just the last one. Take a look at Brian.
Okay. What's going on here?
Full
This
mouth
is-
reconstruction
this looks pretty
here.
bad.
He's same thing. He's got a lot of dentistry there. That's years of dentistry, and then he just got tired. Did not want to go back again. And then finally he was lucky. He found us.
So this is a full mouth reconstruction.
This is a full mouth reconstruction case.
Nice.
He's not worried about what he's eating anymore, what he can and cannot chew. He's not looking at the menu and thinking, oh my God, what am I not going to be able to order? A lot of these people, Randy, their partners have good teeth, but they don't. They're sore, they're hurting. They can't go out with their partners on a dinner date and eat what they want. They're limited.
Okay.
So once we're done bringing their teeth back to life here, they can, they turn expensive because now they can eat what they want. They can smile, they can go out, they can meet friends. They start
So it's
spending.
expensive because they're eating out more.
They're eating out more. They're buying, they're meeting people, they're going shopping because they feel like they're a different person.
Okay, good. So this new thing, so we're calling it full mouth reconstruction.
Yes, we are.
But the public doesn't know. I mean, how do you find a general dentist that has been trained in all of these, in the surgical, in, as you guys say, the restorative? I mean, you have a lab right there on site. What do you ask? Do you do everything right there?
Yes, we do. I mean,
What do you think a patient should ask? What should they look for in a dentist that's going to do a full mouth reconstruction?
I think the patient needs to do their research and make sure that it's a reputable dentist that has a lot of reviews like we do. They want to look and find out that they want to ask the right questions. Are you able to provide these services under one roof? Are you able to give me some samples, like photographs that we've done of work in the past that happy patients that have had the result that they're looking to get? Do you have the lab on premises? Do you have the technology? Can you show me a result of what I'll look like before you even start? And we are able to provide all of that. Do you have the specialists in the office? Yes, we do. We like to think that we're the best in the business in the greater Philadelphia area.
Good for you. Good,
Thank
good. So final message, somebody watching this, they don't like their smile, right? But for whatever reason, and maybe they've heard what you had to say today, but they're hesitant. They're putting it off. What do you say?
I would say to them that if there's something about yourself that's bothering you, that's holding you back in life, you can change it. If you don't like your nose, you get your nose corrected. If you don't like your weight, you start working out, you start eating right, Same thing with your smile. The smile does not have to hold you back anymore. Okay. You can correct your smile quickly, safely, if you want to be sedated, painlessly, and it can all be done in one day if you like at Media Dental Associates.
All right.
And our number's right there on the screen. Give us a call. We'd be happy. We're giving away free consults.
Okay.
And we'd love to have you come on and check us out.
And ask for Dr. J.
And ask for Dr. J. Absolutely.
All right, Dr. J, I want to thank you for coming to the show. Great stuff.
Thank you for having
me.
me,
And these
Randy.
pictures are on your website and things like
are,
that. A lot of
yes.
stuff on your website.
A lot of stuff on the website. There's a lot of information that the patients can glean from the websites. But like I said, we're giving away free complimentary consults. We're giving away complimentary cone beam scans just so the patients can get a completely educated answer about what it is that they require. So we urge them, give us a call. They will not regret it.
All right,
They'll be
Dr.
happy.
J, thank you so much.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.